We're going to go ahead and get started. Good morning. Thank you, everyone, for being here today. It's great to see so many folks. We have some great items on the agenda for you today and some good discussions to have, so we appreciate everyone being here. Yeah, I think we can maybe move together and make space for folks to come up to the table. That would be great if we can. It'd be nice to have everyone all together. Thank you. I know there are lots of copies of the agenda and materials at the back, so we may need to grab a couple of extras for folks. Who can we help with an agenda and a packet of materials this morning? I'm going to guess that Mark needs one over here at a seat too. Awesome, thanks. Great. I know we've got a bunch of folks who are joining us remotely this morning as well, so we'll make sure we include all of that in our discussion today. Great. So we do have a lot of us this morning, but I think given our agenda that we're going to have time to go around for sure to do introductions and to share a little bit about where this group is and where we're headed this morning. So as we have moved from planning to implementation with the blueprint, and we've talked a little bit about this, but I think it's helpful to do a little bit of level setting again today. You know, we've brought new folks around the table, lots of you, which is fantastic. We've had some folks who've been involved with the blueprint since the beginning. As the groups come together, as we move from planning to implementation and we're asking folks to engage in different ways, there's always a bit of messiness in the group process as folks come together, as we learn about each other, as we create shared agenda, how we're going to work together, the goals we're going to move towards. So I just want to acknowledge that. I think this group has huge potential to do great things, given the breadth of the work that's in front of us and the really amazing folks who are around the table. And it's going to take us a little bit of work to get there and to do that together. The blueprint was never designed to be one person or one organization's agenda. This was really meant to be a community process and to engage as many folks as possible. So if one person or one organization could have solved hunger, we wouldn't all be here together. And I think the shared acknowledgement that it will take as many folks as possible in the state to help us end hunger is critical to that. So just want to acknowledge that collaboration is always difficult. What we keep hearing in all of the work groups and from the folks on the governing council is that collaboration is difficult. This is the most complicated process, and this is the piece that all the groups continue to ask for as part of this work, is how do we bring things together? How do we accelerate the things that are working? How do we really bring the folks to the table that can help us solve this issue? So as we do introductions this morning, I just want to say thank you again for being here. Thank you for bringing your best selves to this work. I think that's critically important, and I appreciate that from everyone. So please share your name. If you're interested in sharing an affiliation, please do that. And if you have some experience in working with large collaborations, share with us one of sort of the tidbits or the learnings from that that you feel like has really helped to bring people together and to make collaboration work. Please be brief because we've got a lot of folks. We've got folks joining us remotely. So let's start with that this morning. I will ask that you use a little microphone. There's a button. So you can see that mine is green, which means it's on. And I'll make sure we use these, but there's one for about every 2 people, and then we'll go to the folks on the phone. So name and affiliation, positive collaboration. Yes?
If I can just interject, is there anyone here who needs language translation today? Thanks.
Okay, great.
My name is Gordon Duvall. I'm a community research liaison, and this is my first meeting and just really want to see how I can get involved to help end the hunger.
Hi, I'm Lane Sadowski. I'm the Food System Administrator with the Denver Department of Public Health and Environment and collaboration. I say everything I do.
Hi, my name is Quan Atlas. I would say I had some experience previously collaborating with folks around diversity and inclusion, just in different leadership organizations, just trying to make sure that there was folks at the table. And so I want to make sure I continue that work in this group.
Hi, Mark Kling, Executive Director of the Family Resource Center Association. One large collaborative I've been active in is the ASCEND Fellowship with the Aspen Institute, where 20 Colorado leaders came together in health, human services, and other areas to provide two-generation solutions to poverty in our state. And one of the things I think that's crucial for large-scale collaboration is trying to stay mission-focused on the mission and making sure that we assume everybody is there for the right reasons, has good intentions in being there.
Hi, good morning. I'm Amy Pisani. I'm the CEO of the Food Bank for Larimer County. And I suppose I do have a lot of experience with collaboration, but one piece that might be pertinent to this work is that I was part of the merger team between the Colorado Food Bank Association and the name of the organization I am blanking on right now because this was 10 years ago, that came together to form what is now Hunger Free Colorado, and a founding board member of Hunger Free Colorado. The rationale behind that was that we had two organizations working toward sort of the same mission, advocacy driven, and that neither one was doing a very good job consistently. So we decided to actually dissolve both of those organizations, and Hunger Free Colorado was built out of that.
Hi, I'm Hannah Barron. I'm getting my MSW and I'm interning with Project Angel Heart.
And I'm Rachel Robinson. I'm the Director of Strategic Partnerships at Project Angel Heart. And my experience with collaboration is I chair the Research Committee, Public Policy Committee, and another one I can't recall offhand, which shows I'm a good chair, for the Food is Medicine Coalition, which is organizations like Project Angel Heart across the country that are working towards integrating medical nutrition therapy into health plans. And so in that, similar to what has already been shared, ensuring you're all working towards common goals, shared mission, open channels of communication seem to be the most effective when facilitating collaboration across multiple parties with different priorities.
Good morning. My apologies for being late. I'm Erin Pulling. I'm CEO of Food Bank of the Rockies. Is that all we're covering?
Do you have any advice on how to make collaborations work?
I think for the most part, for me, it's doing a lot more listening as an organization, especially with our collaborating partners.
Good morning. I'm Khadijah Haynes, and I am with K Solutions, that is a consultant for this project to ensure equity, diversity, and inclusivity in the work. It is a work area that I've worked in for several years. I work in two primary overarching areas. One is the arts, and the other is in politics. They are the same. One diva over in politics is the same diva on stage who they're just doing different things. And so to that end, I've worked on many collaborations over decades to bring different factions together to get motion together to move down the road with inclusivity.
Excuse me. Hi, my name is Maddie Keating. I'm with the Natural Resources Defense Council and working on our project called Food Matters. And Food Matters is a national project working in 2 model cities and a number of kind of light touch cities doing reductions, or strategies for food waste reduction and partnering with city partners. So inherently that project, our goal is to be collaborative and to talk to community partners and city staff and entities in cities that know the issues and know the local environment so that we can provide assistance and resources where needed. We're also working with a network of partners at
with groups like the Urban Sustainability Directors Network and World Wildlife Fund to overlap on, or to be collaborative on projects so that we're not overlapping our initiatives. So.
I am Ruben Gregory. I am at Children's Hospital doing food security work there, and I also co-chair the Food Policy Council in Denver.
I'm Terry Livermore. I'm the Food Policy Director at Livermore, Colorado, and the collaboration I was involved in not that long ago it actually failed miserably. But I think the lesson is instructive. It wasn't dissimilar from this in that there was an end goal. It was around human trafficking, but the problem was that everybody came certain they had the right answer, and nobody ever moved off that point. Years later, nobody moved off that point. So.
Hi, I'm Taylor Washington with Hunger Free Colorado. I think my experience in collaboration just always reminds me that authentic collaboration takes a lot of time, and you have to be willing to put in the weeks, months, years to actually gather all the voices and listen and really be able to collaborate well.
Hi, I'm Caitlin McGee, also with Hunger Free Colorado, and I'm filling in for Lindsay Kerner today, who represents the Colorado Food Pantry Network.
Hi, I'm Kevin Warner. I'm a program manager with Trailhead Institute. We're the program office for the blueprint, so we're helping out with the tech and the refreshments and anything else. So if you need anything, please let me know. Another collaboration that I work on focuses on sustainability of community-based participatory research partnerships, and it has people all over across the nation that meet over Zoom. So it's a cool group.
Hi, my name is Justin Batchelder. I work with Metro Caring, and I'm involved with our nutrition education. So we have multiple different programs, and we'll have time to talk about that today, so I'll save that.
Hi, my name is Andrew Stricker. I'm also with Trailhead Institute. As Kevin said, anything we can do to help move this process forward or to facilitate discussions, just let us know.
Good morning. My name is Helen Kadich. I'm at Metro Caring as well. So we have a little bit of your time today, which is really fun. So thanks so much for being here.
Hello, my name is Janae. I'm also with Metro Caring as a community activator. I worked on the Affordable Fares Coalition. I also founded the Rocky Mountain Bus Riders Union. So what I found from the area of collaboration, that if you're going to do community organizing, then the most marginalized voices need to be at your table in order for there to be true collaboration.
Good morning, my name is Donna Garnett. I'm the Executive Director of the Montbello Organizing Committee and the Director for the Montbello Fresh Low Initiative. I have decades of experiences collaborating. I'd love to tell the story that back in the 90s, I wrote a paper for the National Governors Association. They asked me to write on this thing that nobody knew how to do called collaboration. And I used a favorite metaphor that politicians like to use, and like politics, collaboration is a lot like making sausage. It's really messy, but boy, is it ever good if you get to the end product. I've had a lot of experience in leading collaborative efforts around the state, and most recently, the project that we have in Montbello started with 2,500 people who created a vision for what food security looks like in our community. We now have 118 members of our stakeholders group. You think this is hard? And we have several task teams. I think the things that I have learned since 30 years ago when I wrote that first paper was that there are three things that are key to collaboration. One is that everybody has to see themselves in the vision. They have to see themselves at the end. Second, everybody has to be able to take intentional action. And third, everybody has to share in the resources to make those actions happen. That's my experience.
Hi, my name is Sandy Hirsch. I work with USDA Foods Programs for the Colorado Department of Human Services. And yeah, collaboration is difficult, but one success we've had is finding a way to make the team members rely on each other to accomplish something. And once they have a success, they tend to work better together.
Hi, I'm Amanda McQuaid. I'm from Colorado State University. And I would echo what Terry has to say about understanding a group and where everybody is coming from, because I think it helps form collaborations and it helps us respect each other's views. And it also kind of helps us anticipate possible roadblocks.
Hi, everybody. My name is Greg Brazier. I'm the team lead over food distribution at USDA's Food Nutrition Service. Hi, Sandy. As far as collaboration goes, I'm on a number of different committees, mostly with our Indian tribal organizations across the region. But like I believe it was Maddie and Amy had mentioned, I think two of the biggest things with regard to collaboration are organizational listening. That's huge. A lot of people hear different things, but you need a united front on hearing one thing. And overlap of efforts. A lot of times you'll be duplicative in what you're doing, so it's good to know exactly where you're going.
Hi, I'm Carmen Martin with Kaiser Permanente. We've been part of several collaborations. I think it would be really helpful to kind of map out our shared goals and interests and also our assets to see how we can help make some progress on these initiatives. But there's been great wisdom in the room too.
Hi, I'm Lynette Namba, also with Kaiser Permanente, Colorado. And I want to echo what I think someone from Metro Caring said, that I think it's so important to include the voice of the people that we hope to impact and to, keep the end user in mind.
Hi, I'm Elise Lubell, Director of Health Promotion at Jeffco Public Health. Collaboration's hard. It's magical when it works, and celebrate the magic because it doesn't happen so often.
Khalid Morris, Family Tree Market. I'm also working with Fresh Low Project. I got here late, but I imagine we're talking about collaboration. For me, collaboration is a discipline. I think that it's something that you practice, and I think a lot of people know or have feelings around what it is, but it's more of a practice science where you're doing it even when you don't feel like it, just because that's what we do. So that's my take on that.
Jennifer Banyan, serving as a strategic consultant throughout the blueprint process. I've been doing collaboration throughout my career in child welfare and community-based mental health and housing and within government structures and within nonprofits. And I feel like really good, successful collaboration that takes a deep commitment and deep partnerships and equal partnerships. And I've seen really amazing success between community organizations and community voice, really influencing the structures that and the high-level systems that are working to serve folks.
I'm Michelle Ames. I provide communication support to the Blueprint. And I think for me, most recently, collaboration has been about watching a community embrace the entire community and make sure that all were included and all were respected.
Great. We'll go to the folks who are joining us remotely. So we'll start with Austin, please. You can unmute yourself when you're doing your introduction. Thanks.
Hi, everyone. Can you hear me?
Yes.
Okay. Wish I were there with you. My name's Austin Luce. I'm with Consumption Literacy Project. And boy, I feel like I've been creating personal relationship collaborations my whole life, but have been just recently getting into organizational collaborations. And I feel like the same thread of understanding is something that I carry with me in my own lessons of learning, which is seeking to understand and just being humble and through that understanding needs and resources and developing relationships based on that. But anyway, looking forward to the conversation today, everyone.
Great, thank you. We'll go next to Heidi.
Good morning, can you hear me? I'm on the phone.
Yes.
Okay, wonderful. Good morning, everybody. This is Heidi Hoffman. I'm with the Colorado WIC program. I think my best reminder when I'm doing collaboration successfully is to stay curious and open to hearing what the person across the table has to say. Thank you.
Great, thanks, Heidi. Next, we'll go to Julie Mordecai.
Hi, everyone. Julie Mordecai in Alamosa, Colorado. And with being in rural communities, we really can't live without collaboration, especially with how low resourced we are a lot of the time. And I think timing and when you meet has a huge impact on collaboration, especially if you want to look at bringing in more of the community, especially people who work 9 to 5 or 2 or 3 jobs, and being open to lots of mistakes and failing and apologizing and then also walking in without what's in it for me or no set agenda. If you can try, it's sometimes hard. That's it.
Thanks, Julie. Next, we have Hayden Dansky.
Hey everybody, my name is Hayden Dansky. I'm the Executive Director of Boulder Food Rescue, and we're engaged in community-based participatory design research on food access and participation. So yeah, I would just second what people are saying around organizational listening and raising the voices of people who are experts in food access because of their lived experiences. So thanks for having me here.
Thank you. Next, we'll go to Maddie Philly.
Hi, I'm Maddie from the American Heart Association, and I would say, I would echo a lot of the things people have said, but I think the biggest thing is having patience and having humility that we don't know everything, and there's going to be a lot of outreach and trial and error to figure out what's going to work best in every community. Excited to hear what everyone has to say today.
Thanks, Maddie. Next, we'll go to Juanita.
Can you hear me?
Yes.
Okay, this is Ida Montoya, and I'm with Servicios de la Raza. And one of our collaborations that we just are beginning to start is Vision Zero. In my community, most of my clients walk to our organization. And so I am in the Colfax Cloverleaf, so we are trying to get sidewalks better, better improvement for pedestrians, people on bikes that are biking on Colfax, that type of thing. And so I look forward to starting that Vision Zero collaboration here this afternoon. And hopefully we can make Denver a better place to walk and give plenty of food.
Great, thank you, Juanita. I'm going to read a phone number because I don't have a name. It's 303-297-2432.
Yeah, I believe that is me. This is Justin calling in from the Colorado Housing and Finance Authority. I am becoming more involved in our management of the Fresh Food Financing Fund, so am relatively new to the group, and I'm looking forward to learning about the ways that we can collaborate.
Great, thank you. Do we have anybody else come in while we were doing introductions? I think we've gotten everyone. Okay, fantastic, thank you. That was great. So we're going to move on to our next couple of items in the agenda so we can get to our great presentations that we have this morning. So the next thing on our list is, and this is a rollover from the last meeting. So in January actually, we put out the descriptions for co-chairs for this group and asked for folks to self-nominate. And we have actually gotten some of those, so we're going to talk about that today. We have 3 folks who have put their names forward to be co-chairs for this group. And so I thought what we would do this morning is have each person share just a little bit about their interest in that role, the kind of experience they would bring to the table, and then we will open it up for discussion and figure out how to move forward with our leadership for this work group. So I know we have Donna and Amy, and
Sharetta's on the way here. She had a challenge this morning.
Perfect. Well, we'll start with who we have here, and then we'll welcome her when she comes in. So Donna or Amy, either of you would like to share a little bit about yourself, and we'll get started.
guess I'll go. As I said, I'm Amy Pisani. I'm the CEO of the Food Bank for Lamar County currently. I have over 2 decades of experience in hunger relief organizations, but truly starting at the very bottom as a food stamp recipient myself, as an adult, not as a child. So I have that true lived experience. Right out of college, I became a VISTA volunteer in a hunger relief organization. And VISTA volunteers are meant to be community organizers and to start programming from the ground up. So as a VISTA volunteer, I was personally responsible for starting a community garden program, a 12-week cooking class that at the time was very similar to what Cooking Matters is doing now. So even in the 90s, had a very, I had a vision for nutrition being part of the hunger relief space. And then also starting child nutrition programs, again, through lots of collaboration in the community that I was in before. I've been at the Food Bank for Larimer County for 15 years. And in those 15 years, and primarily through that work with what is now Hunger Free Colorado, I think it's very important to have a voice outside of the metro area in a leadership position because groups that are housed in Denver tend to become very Denver-centric, I have found. Nutrition, I know it's a big part of the blueprint, and it has been a huge priority of mine and the food bank that I am now leading for over 15 years. When I ran another food bank, I was the first person, one of the first people in our network to hire a registered dietitian, going back to say that this has always been a huge focus of mine and an interest personally to combine those two. Currently, 40% of all the food that we distribute at our food bank is fresh produce, which is really quite high for a landlocked community food bank. I also have, again, experience from a very high level, macro level, as a food bank director. But our food bank also happens to operate 2 food pantries and 4 mobile pantries. So we serve food directly to the public. We do that 7 days a week at all hours of the day because access is truly important to us. And through those food pantries, those brick and mortar food pantries, we provide food to 500 families per day at each location. And so we have worked with the clients coming into our food pantries over the years to make changes, to seek input and make changes to the access that we provide. So, and access to me means not just, it means the food is in the community that you live in. The food is healthy. The food is, or the actual space that you're getting the food in is conducive to getting in and out, that you don't have to wait for an hour. You don't have to provide a lot of paperwork. So we have worked to make it as easy as possible for people to get food in our community. And that's what I personally mean by access. I think it has a lot of different connotations. The mobile pantries that we started, that was also a result of lack of access. We did a GIS mapping project in our community in 2015. We mapped out 11,000 households that were coming to our food pantries, and we found that there were pockets and areas throughout our county where individuals needed food but weren't getting to us as frequently. And through, again, seeking feedback from those clients, we realized that they were having difficulties getting to one of those brick and mortar pantries, so we added mobile pantries. And I could say that 3 years later, we have improved access in all of the census tracts that we had originally identified as not having high accessibility. Again, back to the nutrition piece, our food bank has started a food pantry in partnership with UC Health. We have a food pantry at the Family Medicine Center. It is about 80% Medicaid. at that clinic. And so the intention of that pantry is to tie hunger and health together and to eventually be able to do some research based on that. Unfortunately, we haven't found funding to do that yet, but we are working toward that. So that pantry's been in operation for about 2 years and is serving another 450 individuals every month. And then our food bank sponsors both the CACFP and FFSP programs. We're the largest sponsor of summer feeding in our community. We cook all of our meals from scratch for both the child programs and the senior programs. So I feel like having an outside perspective outside of Denver and having 20 years of experience all the way from having to use the food system myself up to, you know, community organizing, running food pantries, getting feedback from clients, and now leadership of a food bank, I feel like I would have a good, I would bring a good perspective to this committee as a co-chair. Thank you.
Well, since Sharetta's not here, I guess that's me. So I guess I'd like to start with just a tiny bit of history, if you can.
I'm sorry, Sharita Hadnall is on, and I'm on by phone.
Oh, okay. Hi, Sharetta. All right.
Hi, it's Sharita Hadnall.
Great. So I'm going to go ahead. I want to talk a little bit about history. I started to say, I'm sure you can tell by looking that I've been around the block a few times. This isn't my first rodeo to really think about food and food issues. I grew up in a small farming community in Alabama, and I'll have to tell you that my growing up experiences have shaped all of my approaches to both working with people in a community as well as what it means to make sure that everybody in a community has enough food to eat. Our farm, my grandparents' farm, was such that they grew a lot of food, and when there wasn't enough to go around in the community, they just put it out in baskets by the road. So I learned very early about the spirit of giving and making sure people get to eat. From a professional standpoint, I'll leap forward then to the late 80s and in the early 90s, where I spearheaded as the deputy director of the then governor's policy office, effort around the state to look at what would be the best approach to providing government services to families and children. So I led a listening campaign that involved about 14,000 people over the course of about 9 months. And we heard really loud and clear about things that families wanted for themselves and their children. From that experience, we learned that actually government is not the only or even sometimes the solution, that what communities can do for themselves can be far more powerful and long-lasting and sustainable and empowering for families. But some of the things that came out of that was a term that was only beginning to be utilized at that time, and it was the notion of presumptive eligibility, that you didn't have to go through 111 different caseworkers, which that was a real number for a family that we followed, to be able to get food stamps and health care and child care and job training and so on and so forth. From that experience emerged what was then the template or the prototype that then became Colorado Family Centers. And so we worked diligently to bring together 7 different state agencies that put money into a fund then that was authorized by the Colorado General Assembly to fund the pilot family centers. And I'm very pleased to see that they're 27 now. Is that right? So 30. So some of those are really important players in food security within the communities that they exist. I won't say that all of them are, but a lot that I've still continued relationships with definitely are. Moving on then in my life, I established with my partner the urban farm at Stapleton, which if you've ever visited there, you know that even though there are a bunch of horses and goats and other things, the primary purpose of the urban farm at Stapleton was to teach kids, and especially city kids, where their food came from. So we started that in 1998, and over the time that I was there till 2014, worked with about 26,000 kids to teach them about, where their food comes from. Like other people around the state and some of you in this room, I experienced the effects of a recession in our community, and due to some really, debilitating situations in our family, we found ourselves homeless for a short period of time. And I was so grateful for the food pantry at my church where I could depend on that. So I learned what it meant to be in the shoes of those people I had worked on behalf of for a very long time. In 2013, prior to leaving the urban farm at Stapleton, I kind of got tired of working with folks who thought it was their privilege, that it was they were supposed to be able to let their children come over to the urban farm, and decided that where I really wanted to work was in what are known as food desert communities, and to really have an opportunity to bring small urban farms to communities. The first community we went to was Montbello, and we've worked in other communities, but I'm really happy to say that I found my home again there in Montbello. We now work with 7 small urban farms, primarily at churches and schools, where we are growing food for the community. And thank you, NRDC and Colorado Health Foundation and a whole bunch of others. Our goal through those small urban farms is to, within the next 3 years, be able to raise about 100,000 pounds of fresh produce that we'll give some of it to Khalid's grocery store. No, we'll sell it to you, Khalid. No, we're not going to give it to you. But what it has really, I think, in the process of, from that small effort, creating the Montbello Fresh Low, it really solidified what I knew as a child and what I knew back in the 90s and what I know even better now, and that is that government is not the singular and in sometimes even the solution to addressing hunger. It is one solution, but communities also have the wherewithal and the resources to bring about other ways to take care of hunger and take care of its residents in that. A little bit about Montbello, and then I'm going to bring this to an end. It is a food desert community, even though on the periphery there are 2 very tiny little grocery stores. In a community of 35,000 people, 1 out of 2 kids do not have access to food within a mile of where they live. We know that almost 50% of the people in our community who are eligible for SNAP benefits do not even sign up, and that mostly is seniors, disabled, immigrants, and African Americans in our community. So that's part of our effort at the community level, is to help people get what they are eligible for, among other things. Why do I care about this committee? Well, I signed up for this one because it had the words community and engagement in it. So to me, those are where the answers lie. I'm a very action-oriented leader. I have, I think, had my nerves frayed around the edges in the last 4 meetings. It's like, when are we going to actually do something in this committee? So I would hope in a position of sharing the leadership of this committee to really take an action-oriented approach, yet thoughtful, slow, and intentional. I'm deeply committed to equity. I feel that this has not been at the top of the agenda yet in the work that we're doing. I feel gratified as I've talked to other people and gotten to know folks, that I'm not singular in my desire for this to be an equitable, intentional, action-oriented approach. That's why I put my name in. Thank you.
Okay, we have Sharetta on the phone. We've just asked the folks who put their name forward for co-chair to share a little bit about their interest in that leadership position and a little bit about your background.
Yes, hello there, good morning. This is Sharita, it's pronounced Sharita Hadnal, and I am a Colorado native. I've been here for 37 years now. I graduated from Oberlin, Trailblazer for high school, and I'm a road runner. Graduated from Metro with my bachelor's, and have always really been interested in human services, which is what I got my degree in, with an emphasis on nonprofit management. And my journey has not been extensive as some of yours, but I really have been involved in, as growing up, the thing that made me now be really interested in, specifically in sort of what we're now calling food justice, is when I was growing up, we didn't have, when we talk about access, we didn't have access in the way that you even see it show up now. I remember traveling on 3 buses from the space that we lived in, all the way out off of Federal, to go to what was then the Human Services, Social Services office, to sit all day to receive few commodities and some assistance. And I remember not only the time that it took to get there, the time that we sat there, but the way that it made you feel to be in a space like that. And to be in a space where people treat you as though something is wrong with you for being in need or not having enough of to provide for your family, as though that's something anybody would want for themselves. And so that, for me, is something that has stuck with me throughout my life and became very real. As I found myself in very few instances throughout my life having to access a food bank or food stamps myself, and having to deal with sort of the stigma of how you're treated in the office, how you're treated when you go into the supermarket and you have to utilize assistance. I think about when I had a child and I wasn't in a position to just go and get formula on a regular basis, and I sat out at an appointment to get WIC assistance at 8 o'clock in the morning with my child, and the demeaning way in which that makes you feel when you want to be in a position to do for your family and don't have it and have to be subjected to that type of treatment. And so in more recent years, after having acquired my degree and being in a position to actually financially support myself, I put myself in a position to be able to work with people who are now in a situation where they have to utilize those same services, to really encourage them to not look at this as a way of life, but a temporary circumstance that can definitely be overcome. And so now I currently serve as the director for the Be Well Health and Wellness Initiative's Block Captain Program. And I work with all kinds of residents in various situations, whether it be from a standpoint of needing help to being in a position to be able to help somebody else, and understanding how you go about serving in a community where people are broken and people are discouraged, and how do you work with that in a meaningful way that doesn't further oppress them or further depress them and put them in a state where they feel helpless and hopeless. And so my interest now in serving on the committee is to further the efforts that I have been working on, to be in a position to see things from sort of more of a universal perspective, be able to work on some more large-scale projects and bring some people that are doing great work in these communities into the fold, make sure that people have the information and the understanding about what's going on in our community and around our state and how to get involved. And particularly if you are poor, particularly if you do come from cultural backgrounds where you've been told that that's not what you do, that you don't live healthy, that you come from health disparities, that you come from poverty and disparity, and that's just the way that it is. I want for those particular people to understand how to access power, how to transcend and not believe in everything that's been told to them and how they've been socially conditioned to live. And so I feel like I'm a great candidate because I serve the community, I serve my family, I have lived here all my life. I am very familiar with the issues, not just around hunger, but around housing, around economic development, around education. I have a 12 going on 13-year-old son. I'm very involved in the community. I'm a part of PTO. I serve as the president. I have a 22-year-old nephew that I helped raise that's now at college up in Durango, focused on business marketing. And I have a 4-year-old niece who's right now in ECE and having to deal with how do we make sure that she doesn't get swept up into the fold and that she gets offered the same opportunities that we know a lot of her counterparts are going to get. And so that's my interest in being a part of the committee and my credentials, and I appreciate you all and your time.
Great. So we've got 3 folks who have shared with you their interests and experience. We decided when we started these groups that we would work toward consensus, so we're going to do that today. So I will open it up for discussion. If there are questions folks have or comments about the leadership for this group, this group gets to make this decision. So I want to open it up for discussion and have that conversation today.
How many people? Oh, sorry. How many people can we select to be as chairs? Is it 1, 2? What are the parameters?
So we had said chair or co-chairs. We weren't sure how many people were going to put their names forward for these positions. So you can select 1 if that's what you want to do. You can select more than 1 if that's what you'd like to do. We didn't put a limit or set a specific agenda around that because we weren't sure what was going to come forward from the group.
Thank you.
I'd like to learn a little bit about what the conceived duties are of the co-chair, just the whole, like both working with us and also if there's like a public facing element of this.
Yeah, so we've sent out sort of just a brief job description of sort of what we think those roles will look like. It's helping to set the agendas for the meetings. It's helping to work across work groups. It's helping to inform the governing council of the conversations that happen here that need to be elevated to that level. So those are the sort of main buckets as we've identified them so far.
I just have a quick question. Well, first, I'm really thrilled that we have so many different perspectives and folks with lived experience who are able to share both their current work and how that has influenced them. I think it's really important to think about the issue of metrocentric. And I don't know where Sharetta is, where she lives. And I'd also be interested if any of the 3 candidates also serve on any other work groups and have their voice being elevated in any other way through the blueprint.
So, just speaking for myself, I don't serve on any other, oh, I'm sorry, say it down. Yes. Hi, this is Amy. I don't serve on any other work groups, but I do have a colleague, our program director, who has joined work group 5 and is working in that space. So as an organization, we are very committed to seeing this through and seeing where it goes.
I also am not on another work group.
But you are on the governing council? Right. I was asking if you had other voices, so you're on the governing council. Right. No, I said both. I was just wondering what influence people have in different spheres around this work.
Sorry, Sharita, we cut you off there.
No, you're fine. It's hard. I'm sorry. I know it's hard when you're on the phone. I think the first question was, where were we geographically?
Yes, thanks.
Yeah, so my personal residence, I live in Green Valley Ranch. My work, I do, my office is specifically located in Denver, but we focus on Montbello, Park Hill, Stapleton, Northwest Aurora, and the East Colfax neighborhood. And you asked another question in regards to are you asking, are we serving on anything pertaining to particularly to the blueprint, or just in any other committees outside of this?
Actually, I was just wondering about whether you were serving in any other capacity on the blueprint, whether that's a work group or governing council or any other way that your voices are being elevated or you're participating.
Yes, so I also serve right now as a part of the Mayor's Advisory Council on Sustainability. So I work specifically in the space dealing more with environment, talking about this same particular subject, dealing with food justice and things like that. So I serve on that committee on that advisory committee as well.
Any other question or discussion this morning from folks?
I'd like to hear more about, if we have time, candidates' thoughts around diversity and inclusion. I think the folks talked a lot about, maybe just the first two candidates talked a lot about the professional experience, and I just want to know around what has been the experience of including other voices that are missing, and what will be the effort in that regard, and then more related to the job description of leading and chairing and those types of experiences.
What was the second question?
Just like with the job description, you'll be chairing the group and kind of leading and kind of helping us organize thoughts and action and just kind of what ideas are there, if there are any currently.
Okay, guess I'll start. Diversity and inclusion work. So I, as the food bank CEO, have brought various workshops to the food bank so that I don't have a ton of experience in it, with the exception of looking outward and saying, okay, we need to make sure that this work is part of what we do. So I have personally, probably over the course of the last 2 or 3 years, gone to various workshops, various 2-day, 3-day workshops on diversity and inclusion, trying to train myself into how to integrate that work into what we do. To the extent that in our community, it's difficult because in Fort Collins, it's a very white, middle upper class community, and so from trying to find diversity in our clients, diversity in our employees, diversity in our board members, is challenging, which is why I'm trying to work on that, because I do know that disproportionately the individuals that are using our services are not as white as our community. And so we want to make sure that we are inclusive. For instance, over the last few years, we have made it a requirement that when we hire for our food pantries, that our staff are bilingual. At least one staff at all times has to be bilingual, and that is very difficult to find at times. So that is I don't have a ton of experience with that. I'm learning. And then as far as setting the agendas and the priorities, this is my third meeting. I don't have a lot of thoughts around that at this time because I don't think we've gotten to that point where I can. So.
Okay, I'm going to choose to skip over the first 40 years of my life, but just there are many reasons why I come to be the person that I am in my life today. I'm going to focus primarily on what I've been doing the past 4 years. As I pointed out, the characteristics of our community, Montbello is a very diverse community. 60% of our community residents are Latino. We are a community that has morphed from initially 53 years ago being a primarily white community to approximately 15 to 20 years beyond that first annexation of what became Montbello, became a predominantly African American community, and in the last 15 years has morphed yet once again to be primarily a Latino community. As you might imagine, with those sort of rapid changes, speaking about even 50 years, that's a fairly rapid number of changes in a short period of time. We have a considerable breach across race and ethnicity in our community, and it has been detrimental to both the evolution of the community. It has been detrimental to people developing a sense of trust in what used to be a very tightly knit community. Those threads that hold the community together have really come apart. Montbello Organizing Committee is unique in that it is an organization that is very balanced in terms of our leadership, and that was intentional. I'm one of 3 white people involved in Montbello Organizing Committee. There are 5 African American members of our board, and there are 5 Latino members of our board. That was intentional, and I had a very powerful role in making sure that that happened. I'm not the only person because it was the sentiments of the group. But up until I took over as the executive director, not quite a year ago, I kept hearing at every meeting that I went to, including some of our own, well, why aren't the Latino people here at this meeting? And always the answer was, well, they don't really want to. We invite them, but they don't come. Well, that's not enough to invite people and expect them to come to your meeting. So when I took over as the executive director last June, I first of all contacted the people in our community who are well revered in the Latino community as leaders, and asked them to go to coffee. Can we go to coffee? Can we meet somewhere for lunch, whatever? And I said, I keep hearing this, and I want to know how to make that different, because we've got to have all voices at the table. And it was simple. What do you think the answer was? We don't speak the same language, therefore all we can do is listen through a translation effort, but we can't talk because we don't know the words to say. So we made a change immediately in our organization within a month of, 8, 10, 11 of those conversations like that. Because of the Colorado Health Foundation, we got a sizable grant where we have dual translation at every single meeting. Every person around the table, I don't care if it's a table that's this big or one that only has 5 or 6 people, there's translation, and like at the United Nations, we all can speak our piece and tell our truth, and everybody can be understood. I have felt that it was important to take that experience broader in the community. I'm privileged to sit on several boards and advisory councils in the community, and because of my work at MOP, we have been able to bring this different way of thinking. It's not new, but different way, and people are acting on it. I'm really pleased that one of the Latino organizations called me the other day and said, thanks for helping us. Denver Foundation gave us $5,000. All of our meetings are now going to be dual translated. So, you know, sometimes it is important that a leader be willing to put herself out on the line and have her throat cut or not, because hopefully it will lead to an effective way of doing business differently. Thank you.
Great. So I want to be conscious of time because we have two presentations that we want to make sure we have as a part of the meeting today. So I would welcome suggestions of how to move forward at this point. Sorry. Yes, sorry, Sharita, go ahead.
No problem, thank you. So quickly, I would just say that the work that I'm doing right now has really been around the last couple of years. We really worked on building our residents' capacity to understand how to engage around the issues, whether it was, you know, health, food, you know, transportation, whatever have you, just really understanding how to have a universal conversation, because people were really stuck in what's happening on my block, what's happening to me as an individual, but not understanding how to take that to the entities that really have the power to make the changes. And how do we address that in a universal way so that everybody can get some of what they need and want. Recently, in the work that we've had to do, we've really taken the notion of working on sort of the social determinants of health and health equity, and really through funding that we received from the Colorado Trust have been able to really dive deeper into how are we looking at this from a racial equity perspective, and really helping people to understand how does race play a role in the way disparities show up in individuals, the way it shows up across cultures, and then the way it shows up in our communities, and how then it feeds into the systemic and institutional issues that we are now, you know, addressing through all of these programs and policies. And so, you know, the way that we really focus on that is we're going to address some immediate needs around what are you experiencing when you apply for food stamps, when you go and utilize food stamps. What is the stigma? What is the feeling? Because it's not just a matter of not applying because they don't know where to go or they don't understand how to fill out the paperwork. It's deeper than that. So part of the work is really understanding what are the barriers that you're experiencing that keep you from partaking in programs and services that are there to benefit you and help your life and get you a better quality of life. And then the second part of it is once we have you in a better state of mind, how do we actually move forward into creating policies to make the work of those programs actually sustainable, to make it become sort of ingrained in the culture of how we live every day versus it being something that somebody just does for a period of time, funding runs out, then we move on. That particular, you know, issue is forgotten about, although it hasn't been resolved. And so we really work on not just helping people understand how they show up as an individual and where the aggression, where the depression, or whatever those emotions are that they're feeling are coming from, but then how do you actually place those in a space that will create meaningful change? And so whether that's, you know, breaking it down into, you know, going into workshops and listening and understanding the history and culture of America and undoing racism and how this has happened, or understanding how we are each complicit and what we do now in our jobs, as somebody stated, when we're looking at the hiring practices, when we're looking at how we're working with our interns, how we're encouraging them to show up and be present. We work currently with Platt College nurses. I just had a couple of interns that finished with me, and it was 2 white young ladies, and they did an excellent job of inserting personal life experiences when presenting to my block captains, and that's what I need. I need for people to understand how they show up in this work as a human, as an individual, and then how that helps them to break down some of these barriers, whether it be in the health industry, whether it's food justice, transportation, or what have you.
Great. So we're going to take just a couple more minutes on this conversation. So there are a number of ways we could move forward. If someone wants to put forward an option for the group to talk about coming to consensus around, I'm open to that. If this discussion we feel like needs more time, we can move it to next month. We can do something in between meetings as well, but I really want to be respectful of the folks who have come here to present and make sure that we have the time for them to do that. Go ahead, Erin.
I'd make a motion that we accept the 3 nominators who put themselves forward to serve as the 3 co-chairs.
Great. So the way that we have done some consensus work in the past is I agree, I can live with it, or it's not something I can live with. And so I want to do just a heat check in the room, and we'll have folks who are online who can do the group chat, do that. And if you are on the phone, we'll have you opt in. But I just want to do a quick heat check for folks. So Erin has put forward a motion to have the 3 folks who put themselves forward serve as the leadership team for this work group. Mark, you wanted to opt in.
I just thought I'd ask the question, are the 3 people who have been nominated comfortable with that arrangement? Would they be willing to serve under that arrangement?
Thanks for asking that question. I like the idea of co-chairs. I'm just not sure how 3 people trying to be a threesome co-chair would work. I think if you're trying to establish leadership, and to spread that out would be more difficult. So I'm sort of here with that. I'm not necessarily here.
Donna or Sharita, would you like to respond to that?
I can live with it. I certainly, as I said, collaboration at any level, whether it's 3 people or, 2,500, is always requires a great deal of stretching and growing. And so I can live with that. I think, of the 3 people, myself included, we bring really diverse experiences and knowledge to the table. So I can live with it.
And Sharita here, yes, I agree. I think that, there's always going to be times where we're pulled in different directions. And so, having 3 people who are very much aware and engaged in what's going on and can jump in and take the group in the direction it needs to go whenever we need to go is what's the point? We're trying to get the work done. And for me, it's definitely not about, being in a position of power. I have plenty other places to get that satisfaction. And so if, sharing is absolutely fine with me.
I'd like to say that it's going to be important for you to move forward in order to get multiple perspectives as to how you can approach these issues. What I feel like everyone.
Press your mic.
Sure.
There.
Yeah, I thought I was loud enough. For the phone folks. What I feel like is going to be really important is being able to have different perspectives. I'm not really comfortable with the fact that there only wouldn't be one person as a chair, considering the fact that there are diversity, equity, and inclusion work that still needs to be done with a lot of the folks here. So I would say that there definitely needs to be more than one person as the chair, to get multiple perspectives of how hunger shows up, how we got to this point. The racial aspect of it is actually really, really deep within hunger. So in order for this to be a fair group of voices, I think you need more than just one chair on this area.
Great. So just really quickly.
Yeah, so I wanna say that I'm fully supportive of the motion. I think 3 is great. That 1, there will be a tiebreaker of sorts. There will always be a majority within that. consensus, if there is any sort of, two options or something like that. I think there's a great opportunity there, and more voices is always better, in my opinion. And I think the different perspectives that we've talked about, I couldn't see us losing one of those in the leadership. So.
Okay. So
I want to say that there's something on the that I think we should consider. So we have one of three candidates saying that, it's hard to navigate three, which I would say is true with a facilitator. And then we have a suggestion to put together subgroups so that we can move forward. And I think we need to be thinking about that. Because we're now, way over, and there's no consensus, and it is tricky to move forward with three. So So
here's how I suggest we move forward this morning. So we are going to cease our discussion about it right now. For the folks who are in the room, we have notepads on the table. So if you could put on that note, I can live with it, I support it, or I do not support moving the three people forward for the chair. We will collect those. For those of you who have joined us remotely, you can email Kevin your responses. And we're going to take all of that into consideration and see if we are at consensus or not. And we will bring this back at the next meeting, because I want to be sure that we have time for our presenters today. I appreciate the thorough discussion, and let's have everyone write down where they are. We will see if we are in a place of consensus, and we will, if we find that we are, we will let you know just as soon as we can. If we need to have more discussion at the next meeting, we will certainly do that. So please, put those pieces together. We're going to have Kevin collect all of that. So yeah, I think it's best, Kevin, because he'll get the emails as well. Then he'll have all the information. And we are now going to move on really quickly. There was an email sent out by Kevin earlier this week, a rule change around SNAP benefits with a letter. If you are interested in signing on to that letter, you can let Alexis Waitman know by the end of the week. There is also an opportunity to submit individual comments, which is really important in this process as well. So there's great information on Hunger Free Colorado's website. There's an email that went out earlier in the week, and if you have questions, you can email Kevin and he can help you with that. We won't spend any more time on that this morning. So we're going to move on to Metro Caring, who is our first presenter this morning. And welcome to have you folks stay where you are. You can come up here, whatever makes sense. Please use the mic so that the folks on the phone can hear you, and we'll turn it over to you. Wherever you're more comfortable. I do not have an opinion on that, so it's up to you.
Hi, everybody. My name's Helen.
Hi, my name's Janae. I'm from Metro Caring.
Yeah, so we're your Metro Caring team. We had Justin here before, but he had a 10 or an 11:30 that he had to run to, so I apologize that he's not here to grace you with his presence and presentation skills, but you got me and Janae this morning. I also want to name that I'm an Aries, and it is Aries season, so when we were planning this this presentation, I got like super fired up about it. And I think part of the reason why I'm feeling so fired up is because we just have a long way to go. And it seems like this hunger thing is just not going away. And we're seeing the need grow over at Metro Caring. And I really just feel honored and humbled about the way that this conversation so far has gone this morning, and thinking about DEI work, diversity, equity, inclusion really being the foundation of our work here. So I'm just feeling really humbled and grateful for everybody in this room. Great. Okay, so y'all know about hunger. Just to give you a little bit of a brief history, I'm really happy to see Ruben in the room, who could probably give this history even better than I can. But Metro Caring is about 45 years old. We were co-founded by a number of different churches in town who are running separate food pantries, realizing, hey, we can do this better together, and they banded together to create Metro Caring. We're right up the block, and the history of Metro Caring is just your traditional food banky, food pantry charity organization. So it was a brick and mortar spot actually at our original site over at 18th and Downing, where volunteers would put together boxes of food for folks and hand it out the window for a line of people coming up to receive their food assistance for that day. We all have learned and grown so much from that time, and thinking about how each one of us have dietary restrictions, how each one of us have cultural preferences of what we want to eat, and just that power of choice. So we've really shifted from that, and we've really come to being an anti-hunger organization. So with all of that shift work, we are making so many mistakes and working our butts off and thinking about how to truly make this shift of being of having a history of being a very traditional charity-based food distribution, food pantry organization to a community center that's working in solidarity with our community here. So we're addressing people's immediate needs while addressing root causes of hunger. So kind of the way that we're thinking about it is the immediate need is being met. Y'all should come down the block. We have a beautiful market just a few blocks away. So feel free to walk back home with us after this meeting if you want. But we're meeting that direct need. So people are coming to us, receiving food assistance, having their taxes done today, coming to cooking clubs and cooking classes. And then we're really thinking about, and then what do we do with this community center? So we have about 500 weekly volunteers, most of which are there every Tuesday, every Wednesday, many folks who are completing work readiness hours. So we have a huge community that really knows each other and is relationship with one another. And now we're thinking, how do we harness this community and mobilize that to create community change? So we have 3 main buckets in which we do this work. So the first one is nourishing neighbors, tools to thrive, and fostering community. I'm going to jump into all of this in just a moment here. First piece is tools to thrive. So in addition to our food access work, we provide a number of wraparound services is what we call them. So it's everything. I mentioned tax assistance. I've done my taxes at Metro Caring totally for free for the last 2 years. It's the best thing ever. If you haven't done your taxes yet, you should come back over with us this afternoon. We have Denver Human Services at the community center twice a week for benefits enrollment. We do employment assistance. We do utilities assistance. So a number of different programs in that area. One of our largest programs is actually a statewide grant where we provide vouchers to receive your driver's license, your ID, or your birth certificate. The number one reason why people are coming in for that is for employment and housing, and we operate that program all the way from Grand Junction to Greeley. So it's a statewide program working with about 30 different agencies across the state. The next piece is nourishing neighbors. So this is where our market comes into place. So this is where I just want to name that, that we haven't fixed this problem. And we are just witnessing that at Metro Caring more and more every day. So we run a fresh foods market where we focus on healthful food items. So we have a nutrition standard for what's in our market. So if it exceeds, I think it's 11 grams of added sugar per serving, we actually do not put it in the market at all. So we know that food insecurity is linked with preventable disease like diabetes type 2, and we are taking ownership of that as an organization who's been doing food distribution for 45 years. So what was our role in that? So that's where we create these policies around what is in our market. We're also looking at sodium content as a player in that as well. There isn't any restriction on who can come into the market. You are all welcome to come in and grab your groceries from there. There isn't citizenship qualifications. There isn't income qualifications. We know that families know themselves best and individuals know themselves best. With that, it's a choice market. So folks are able to come in and just walk through the market as if it's a grocery store. That being said, folks are able to come in once every 30 days. We have 127 appointments during regular business hours per day. We're opening up the phone lines to set those appointments, and all of those appointments have been getting booked within 2 hours of opening up our phone lines in the last 3 months. Again, that's just with folks coming in once every 30 days. This is data for you. It's pointing to the nutritional content of what's in our market. So I'm sorry that Justin isn't here. He's on our nutrition team and is actually starting his MSU program to be a registered dietitian. We have one other registered dietitian on staff as well. So this is just naming the market's looking good. On average, folks are leaving with about 90 pounds of food for their families. So we wanted to do just like a case study as one of the pieces on how we are really doing the shift work from more of the charity-based organization and beginnings of Metro Caring to becoming a solidarity-based organization. So we wanted just to focus in on our nutrition programs for this. So the goal with the nutrition programs is to foster an inclusive community with improved well-being. So there's a number of kind of standards of what we want our nutrition programs to be and feel like. First one is community-centered, practical, grounded in evidence, culturally relevant, skills-based, and really important is fun. One of our core values is find the fun. I hope that is one of your core values too in this work. So we have a number of different programs within the nutrition program. This is a list. Wanted to just jump into two examples. The first one, so I think about a lot of the work at Metro Caring and a lot of the potential of our work as food access organizations and how this relates to so many other facets of life. So again, really want to name and appreciate the conversation around race and class and where people live, whether that's in the city or in a rural environment, what their communities look like. So just really appreciate both the evidence-based programming and then pairing that with true community and relationships. So our Cocina program, we were running 2 cooking classes primarily for adults in English at Metro Caring, and this really amazing badass woman named Ava came in and she was going to those classes and she said, these are really fun, these are really great, I've been learning so much, and you're not offering them to my community. And she said, you know what, I can just do that for you. And so essentially we handed over the keys to Metro Caring, and Ava has completely established a whole nother program within Metro Caring that's really fostering community with our Spanish-speaking participants. And it is phenomenal what is happening. So it's a cohort-based program that's focusing on cooking skills as well as nutrition, primarily for family households. And what's really amazing about it is it's not only like evidence-based in its curriculum, but it's really harboring community in this way that after each cohort, the cohort designates who is the leader within that cohort, and that individual then leads the next cohort. So it's one of these things where we're really identifying the leaders within our community that could be seen as in the past, a participant or a client or somebody receiving services, and really identifying what are the strengths in every single person that's coming in and where's the leadership, and let's hand over the keys. The diabetes self-management program has also been incredibly successful in this way. We're using a program called Journey for Control, which is any registered health professional can run this program. And it's been used. We're just seeing an incredibly high graduation rate at Metro Caring. So again, what I want to stress on this is it's evidence-based programming about really facing a hurdle that so many folks live with in our Metro Caring community. But it's taking this evidence-based programming and then really focusing on what are the relationships and support systems that make us successful as a community. So we've seen close to an 85% graduation rate, which is phenomenal for these types of cohort-based programs. And the feedback that we're getting over and over again was, I've had diabetes for the last 20 years, and I never had a community to talk about it with. And so it's really a piece of seeing each other, being across the table from one another, and co-facilitating this process of, hey, this is what's really worked for me. I want to share that skill with you, and then receiving that as well. So it's again and again, each cohort is really coming away with hard skills, evidence-based pieces, but also these relationships that are long-lasting and allowing for these successes. The cooking clubs are just like the best thing. So we have our our former coworker, who she was a refugee from Sierra Leone, and one of our oldest staff members, named Hawa, who's pictured on the bottom right there. She was a phenomenal cook, and was the custodian of Metro Caring for years and years. And then Tiva, who's our new executive director, really saw Hawa and said, you need to teach about this. And Hawa started the West African Cooking Club. And these programs are not focused on what's the nutritional content of anything that we're putting in here. It's what's the cultural value and what are the relationships that we're building. And it's been phenomenal to see what has happened of the families that are coming through and teaching one another. Hawa just about burnt me out during one of her last classes. She did a habanero pepper sauce that I thought was like a sweet pepper sauce. And I went home and it was sweating from every pore of my body and went home crying. And I was like, oh, I don't know if I can come back, but this is amazing. So we have a West African cooking club. We have a Middle Eastern cooking club taught by a woman named Nawal Thompson, who came through our employment services program. Phenomenal cook, decided to take a leadership position, and now she's running the West African Cooking Club. Ava and some others are also running a cooking club in Spanish, where it's really like a family-centric opportunity for folks to come together. And just recently we had a man named Anthony, who is very core to the Metro Caring community. He came up to a number of us and said, hey, y'all don't really have anything that's celebrating the African American culture at Metro Caring right now. What's up with that? And again, we handed over the keys, and 2 months ago, for the month of February, he started a soul food cooking club that is by far our most popular cooking club. He made a etouffee in the first week, and it was so good. So again, it's just one of these things of our 22 staff members don't have all the answers. We don't have every language, every culture, every experience represented. So what does it look like when we really share power and really harness the power of community to make change happen? Oops, I did something funny. I also just want to, I'm so honored to be working with Janae now. So we started collaborating when Janae was at 9 to 5 around transit issues. And in our fostering community piece, we're really, again, thinking about how do we take this community center and all the assets that are here in the community center and really pull strengths from folks to make change happen. So how do we mobilize community to make change happen? So we've been building out this piece of our fostering community bucket, as you will, at Metro Caring. And we have now hired 2 community activators, which are real. So I'm gonna hand it over to Janae now, who is on week 4.
Yeah, it's my first month now at this point.
First month. So I'm gonna hand it over to Janae just to talk about our activating community piece.
So I get a lot of questions as to what community activation is, and the explanation is actually right in the title. You are activating your community. What my job and purpose is to bring people to the table that have felt left out, that don't know that they have a voice there, or don't feel like they have been invited to that table. So when I was working at 9 to 5, I was doing a lot of work around lobbying, but also doing a lot of work around public transit issues. And what I found out is that every 4th Tuesday or 3rd Tuesday of the month, there is a chance to go and testify and speak to folks or speak to the board members that are more or less making the decisions for people that are not in the room. So what I would like to do and what my job is to bring people into the room that have been left out of that room, is to get people elected in areas that have felt like they can't get elected in these areas or don't feel like they've been represented properly by the people that are in power, making decisions about their bodies, about their homes or where they can live, about their salaries, and really starting to shift the narrative about there are no conversations about us without us. So that is why I'm here at Metro Caring. Metro Caring has a huge base of volunteers and people that come through and participants that come through that, you know, that's an area to tap. So if you've got a lot of people coming through your space, asking those questions as to how they can be in different spaces to really start tackling what food scarcity looks like, what gentrification looks like, what health equity looks like. So with all those folks, there are so many different people that come through that are already thinking about these issues, are already being affected by these issues, that are already, been disenfranchised in these ways. How do we start to build power on a political scale to get them to mobilize and actually become the narrative, part of the narrative, to become the story, to be the ones that are making the actual decisions within areas of power?
Yeah, so thanks to me. So I want to wrap up in thinking that in saying that diversity, equity, inclusion work is like the very foundation of the work that we're doing at Metro Caring. So we're thinking about everything as a community and how we make decisions on who's sitting on our board, on who our volunteer base is. So in every area we are talking about this. And I also want to name that we are like making a ton of mistakes along the way as well. So I just want to share that we want to be like in this journey and on this road with each other of what it looks like to create the world that we all get to live in and all get to succeed and thrive in together and have fun in together. So just want to name that and say if y'all are working on shifting any pieces of your work from, these ways that we've been doing anti-hunger work for decades that have not been working, and you want to get a little creative and think outside the box and listen a lot and do this shift, we are in this with you, and we want to collaborate genuinely with you. So just know that our doors are open. I also want to share that we give program tours, so I'd love to see y'all come in, specifically for partner agencies, and that's on our website at metrocaring.org. And I'll just volunteer the two of us that we just want to be in conversation with you about all of this. So yeah, thank you so much for your time. Super appreciate it.
So in the interest of time, I think we'll hold questions till the end. So I want to turn it over to the folks from Hunger Free Colorado to talk about the Food Pantry Network.
Hello, everyone. Like I said, I'm Caitlin, and I'm filling in for Lindsay, who is the manager of the Colorado Food Pantry Network. So forgive me if it sounds like I'm just reading off of paper. It's because I am. So, so do I need to...
Yeah, do you want to use your mouth?
Okay, so a little bit of background. The Colorado Food Pantry Network is a result of the Full Pantry's Full Lives Leadership Institute. So this was a 2-year project facilitated by Hunger Free Colorado and funded by the Denver Foundation. It was launched in April 2014 to support a group of food pantry leaders in creating a system that best serves those impacted by hunger. So it was comprised of 8 food pantries to start, and they were all located in the Denver metro area. Throughout the process, the Institute collectively worked towards improving governance structures for each food pantry, which in the end helped improve food pantry operations to better meet the needs of those they served. And it also fostered change through collective action. Over the course of the Leadership Institute, the leaders explored several different topics and thought other food pantries might be interested in what they learned. So to facilitate the sharing of ideas and best practices, the members of the Leadership Institute decided to create a statewide network for food pantries, and the Colorado Food Pantry Network officially launched as a statewide program of Hunger Free Colorado in 2015. Currently, most of the regions in Colorado are represented with over 100 or around 100 food pantries as part of it. So these are the values. I'll just read the statements that the Colorado Food Pantry Network came up with. So for partnership, we are stronger together than we are alone. For learning, we seek to learn about and replicate best practices, assess our work, and incorporate lessons learned into our work. The third is equity. We first focus on those experiencing hunger by listening and responding to their needs, and that guides the decisions we make. Fourth is advocacy. We use our collective voice to create a stronger charitable food system, and we open opportunities for the voices of the hungry themselves to be heard. And the last is hope. We inspire hope for all and support model pantries that show the path to greatness. So those are the values of the Colorado Food Pantry Network. I'm just going to talk about a few successes that happened just over this last year, 2018. So Lindsay and the Colorado Food Pantry Network hosted their strategic planning meeting last May. Over 50 food pantry members convened to discuss how they wanted the network to grow and evolve. And before this meeting, Lindsay actually had an external consultant work with the different members of the food pantry network, and they were surveyed, interviewed to see kind of what they wanted to get out of it. The results from the strategic planning meeting were that members identified specific goals and initiatives. I'll go over those initiatives on the next slide. And then the second success of that meeting was that Lindsay saw a greater increase in member engagement, and there's been higher attendance at meetings, events, and members have shown enthusiasm and more participation around all the initiatives that they worked on. The second success from 2018 was the Food Pantry Assistance Grant. Hunger Free Colorado's policy department worked with the Colorado State Legislature Joint Budget Committee to get $500,000 included in the state budget for food pantries and food banks to purchase Colorado Proud items. Onward is the foundation that is managing the money. They reported that over $2 million in funds were requested between December and February, which is exciting because that's only 3 months. And all the awards have been distributed, so food pantries and food banks are in the process of spending the funding. There have been like a few creative ways that people have thought about spending the money. Some examples are purchasing whole cattle from ranchers and having the beef delivered over the course of a month, and other pantries have been working on ongoing egg shares. So just some different ways. Okay, so these are the initiatives from the meeting that was last May that the Colorado Food Pantry members identified as areas of interest. So the first is an online community, which will be launched in a couple months. This would be a place where members can ask questions, post articles, share stories and resources. And they have been starting to train people on how to use this platform efficiently. The next was that food pantry members wanted a regional approach. So for members outside of the Front Range to better participate in the network, pantry leaders wanted to host regional meetings, like smaller regions. So this has been started in Montezuma, La Plata, and Archuleta. The third was strategic partnerships. Pantry leaders were really interested in working towards building stronger relationships with interested partners, for example, farmers, elected officials, and other pantries. So this work's been ongoing since the strategic planning meeting, and some very targeted and deep work with farmers is underway. The fourth is collective purchasing. Food pantries are interested in making shared purchases when geographically appropriate. The idea is for interested pantries to come together to coordinate the purchase, delivery, storage, and sharing of a purchased product. And then the last thing that came out of that meeting was food pantry field trips, which have been going on since that meeting, and they were really successful, so they're going to keep doing those in the future. The next part I'll talk about is the client input survey. So the next couple slides are more data driven, but the client input survey is a 30-question survey that asks clients about their food preferences, reasons for wanting to eat healthy, experience with food insecurity, participation in SNAP or food stamps, and customer service. So the results of this survey show pantries where their clients' preferences are and help drive support for change in operations or services. Hunger Free Colorado, we use the data to drive policy interests with the hope of creating systemic changes that affect those who are experiencing hunger. Tech support and all analytics were provided by Lindsay. And over 3,500 pantry visitors have participated in the survey so far. So I'm just gonna read these. So the 82% of clients identified protein, produce, and dairy as the most important product to receive in the food pantry, and 73% identified one of those items as the second most important thing. So this data point is kind of what drove our food pantry legislation that we ran last year. And then the second point is that almost 60% responded that it's not important for them to have baked goods, candy, or instant foods in a food pantry. The next is about dietary restrictions. 65% reported that restriction was due to medical necessities, and 37% responded that they're trying to eat healthier. I think this is my last. So of those surveyed, this is almost 25 have been visiting a pantry for 3 or more years, and over 40% have been visiting food pantries for less than 1 year. And around 43% of respondents received SNAP benefits. And that's all from me. If you have any questions, Lindsay's email is going to be at the end, and also I'll write down questions too and take them back to her, but I'm going to turn it over to Taylor to talk a little more.
Thanks. Could you hand me that clicker, Kate? Okay, so Lindsay had asked me also to talk about ways that we're collaborating and consulting with folks in other aspects of our work. From our conversation today, this is probably a repetitive slide, but I think it's important for everyone to sort of be on that we use terms that they're important to define. So when we're talking about lived experience, we're talking about not something that comes from school or a formal education or a training program, but rather an experience in someone's life, either currently or in the past, and their expertise and understanding that they know and have experienced that system and have navigated it, so they know what works well and what doesn't. I also have printouts of this because that's really small. In an effort to save paper, I made them half sheets, which is also pretty small. So I'm hoping the people on the computers are able to, are on the phone, are able to see this, and if not, we're sending this out in notes afterwards to go through it really thoroughly. But in holding ourselves accountable, a lot of our work that we have done is in that consulting bracket, and so this chart is sort of looking at the ways that you can increase power and the way that people are able to have impact in the decisions and the issues impacting their lives. So if you look at that bottom row, a lot of our work has focused on surveys and focus groups, community meetings, hearing from community about an issue that we have set already, being hunger, being the Denver SNAP Task Force, a range of topics, and then asking for consulting on those issues. So knowing that just Hunger Free has work to do in terms of how we incorporate the voices of lived experience, and we're working on sort of growing towards more towards the right of these boxes to the piece of empowering community. This comes from the Collective Impact Forum, which just has some really interesting things about community engagement if you're interested. So one of our examples of consulting with lived experience was the Denver SNAP Task Force, of which many folks in this room participated. So FRAC, Hunger Free Colorado, and the Food Trust came together and coordinated, I think like 80 different organizations to identify recommendations for improving access and participation to SNAP in Denver County. Most of you probably know that in Colorado, food stamps are distributed by county, so we were looking at Denver County's procedures. So there were really strong voices in the room that were advocating that the SNAP Task Force include more lived experience. There were some folks in the room with lived experience, and as we've said today, the more voices you can capture, the better bandwidth or broad and then widened understanding you can have of the challenges people are facing when trying to enroll in SNAP. That being said, there are 77,900 people on food stamps in Denver, and we surveyed 51, or focus grouped 51. So in our recommendations, there was a point of continued engagement and continued ways to gather feedback from folks that were in the DHS office continuously, because even with the groups that we were able to speak with, there was a significant number of working families that we we didn't hear from. We wanted to hear more from immigrant and refugee communities, those attending college. So there were just pockets that we were still missing. We partnered with groups that had already established trusting relationships with folks who were participating in the SNAP program. Metro Caring was one of them. That was a really great partnership. And so in those focus groups, we had open-ended questions about some of the ways that the SNAP process was good and bad. We kept it pretty open, and we were mostly there to listen and for that feedback to guide what those recommendations said in the final product. We also felt it was very important. Sorry, how do I go back? Previous, thanks. To make sure that it was as accessible as possible. So we were able to provide translation, childcare, food, bus passes, and compensation. And we also really valued that participation very highly, as we would a consultant that we had hired to bring into the organization in any other capacity. So those who chose to have their names were cited as consultants in the Denver SNAP Task Force report. And if you have questions on this process specifically, I can answer those at the end. We also recently did something with the Jeffco Eats Backpack program. So that backpack program had consistently been hearing feedback that kids weren't taking the bags, that families didn't participate after a few months, and there weren't very clear answers onto why some of those things may be. There was a lot of speculation, but no way to collect that information. And so we focus group students, high school students and middle school students, and talked through different sections of that program. So like the food itself, the process of how students were getting food, with the stigma piece being a concern. And then from the perspective at home, if that food was being used for parents to cook meals, for kids to have in between classes as snacks, like what were the priorities in your household for the kinds of foods you wanted to be receiving each week. And there was just really great engagement and feedback. And it was the first time the youth that participate in that program had been asked what they thought of this program that was sort of being pushed on them. And so they gained some of this ownership, and in some of the schools now are looking to, their leadership to implement different ways to advertise the program for different formats of how the program will work, right? So not just traditionally a backpack home, but like make your own bag and pre-made bags, different stations throughout the school for kids to be able to take something between classes, talking about like creating videos during Spirit Week. So all of these great solutions that were coming out of the youth who were in that school, some of whom didn't know that this program existed and just thought that food came home with them on Fridays. So there was a lot of great feedback from those focus groups as well. Yeah, so those are just two examples of some of the work we're doing. I think another great program is our Hunger Through My Lens program that Melissa Baker coordinates, and I think at another work group is potentially talked about, but happy to talk about that as well. Otherwise, I don't know if we don't have time probably to open it up for comments, but feel free to email us.
We've got about 5 minutes. So I want to let folks who have questions for either of these groups have a little bit of time to do that.
I'm curious about your survey, the Jeffco Backpack survey. So did they initiate asking you all to survey?
So they were focus groups. Yeah, there were no like paper surveys, but the
No. I mean, did the backpack program itself ask you to initiate the survey for them, or?
The backpack program came to us and said, do you have suggestions about how we improve this program, because we're getting a lot of feedback? And I said, have you asked the kids? And the answer was no, so that's where we started. Yeah.
And did they see that feedback well? Have they been able to incorporate some of the suggestions?
Yeah, so at the end, a 2-page report was created, and that is going to their board to help guide their funding for the next year to figure out how they can prioritize purchasing some of the top-rated or most frequently discussed and desired items. So of course there's Pop-Tarts and Takis and that sort of thing, but there was a consistent request for fresh fruit, for salads, for a lot of produce. And so those things like smoothies and power bars, those sorts of things that weren't already in the budget to purchase or to figure out how to source those things, they're now looking at different ways to source some of that healthier food that the youth specifically requested. Yeah.
Is there a reason why they chose Takis first and Pop-Tarts first as far as like food to give youth?
Oh, so that was more when we asked youth what they wanted. Those were some of the first things that. No. So I think that a lot of times we hear that kids don't want healthy food or that they eat a lot of junk, and so the kids, that was definitely in the balance, and I always say that that's like also in my balance, right? So like I eat healthy food and I also like ice cream, and like no one shames me for that. So ensuring that we're not just reporting that they want like all of this produce and healthy food, but being realistic about like the sorts of foods that they have in a balanced diet. They do. There was like a recent load of snacks, and so they had like a ton of snacks, and the kids were stoked. But that doesn't happen. That's like a once a year sort of situation.
Another question I have for was how often were they able to get their backpacks so that was like a once a week type of deal, or is it like an every day type of thing?
The schools have different formats on how they run the program. So in the middle school, it is every Friday. Kids get like grocery bags of food. One of their requests was actually that they have a physical backpack to put it in. I think McLean High School has teachers that are they have like stations in their classrooms, and kids can just go grab things. So it's not a traditional backpack program at all. It's more like food closet in the school that kids can just grab things between classes if they didn't bring lunch or if they don't have a breakfast.
For the Food Pantry Network survey, which I've gotten to see a little bit of through some of our food rescue work within our DC, I know it was really valuable for us to see here's exactly what people are saying they want more of versus what's available in the system. I wondered if you all would be able to share the strategic plan for that network with us as a sort of follow-up, or if that's more of like an internal document.
I can ask Lindsay. We have like a timeline document that we're allowed to share, or that we do share, that kind of says like what we did with the survey data and like how it got taken throughout the past couple of years. So I can send that out, and then I'll ask Lindsay to follow up too. Great. Yeah. Thanks.
This was great information. I have one question about the pantry survey as well, around whether you're, and actually just the work that you do when you're kind of talking with the full network. If you're able to, have you been able to quantify barriers to access around like hours, location, and in particular for me right now, I'm hearing a lot about ID requirements. Like, do you have any way of like quantifying it, like which pantries are requiring that type of documentation, and if that's a barrier out in the community?
I know our pantry map that we keep updated on the food resource hotline has an area where we track what the required identification is for each of those pantries and the hours that they're open. I'm honestly not sure if the survey captured that information, but our pantry map, so for example, if a family calls in and they are looking for a pantry that does not ask for any sort of documentation, we can find where that pantry is, but I'm not sure if it's been quantified, but we can ask. Yeah.
Great, and I'd like to know if that comes up in discussion with the full group around it's like a small P policies, not something you could do statewide, but could the group make some recommendations about small P policy, meaning it's not a great practice to make people bring documentation in and make that
Yeah.
Okay, thanks.
So really quickly, Carmen, we're
Okay.
out of time.
I just have a quick question. Metro Caring, you brought up some great examples about building community with the West African, Mediterranean, different types of groups. Were you able to translate any of that into the Caucasian community, and how has that influenced some of your practices?
That part.
That's such an interesting question. So I think this is professional, right? I've been working on my professionalism recently, and this is where I'm at. Cool. I think the reality is that Metro Caring has been like a monolingual English-speaking center that has been primarily white in its volunteer base, and so it kind of like has been like a white center in those types of ways. And so I think a lot of what we're thinking about is not necessarily, we do have affinity groups on our staff. So we have like a POC affinity group and a white ally affinity group in our staff now, which is great on that level. But I think as an organization, we're really thinking about how do we undo some of the traditions that have been built in this charity, which has been around white power in a lot of ways, especially in our volunteer population. And so that's what we've been thinking about and prioritizing, both in like financial resources for stipends for folks who are participating in focus groups, who are running these cooking classes, who are running these cooking clubs, and then also thinking about like translation and inclusivity on that level.
Great. Well, we are about a minute from time. Is there anything else for folks for the good of the group before we all head out to the rest of our day? All right. Well, we will follow up with you on the leadership for this work group and make sure that we get all that information and get that back to you. And we'll look forward to seeing you all in April.